Well, good afternoon, everyone. It's really great to be here with you all. First, I want to start out by introducing myself. My name is Malcom Glenn, and I'm really excited to be here with you all today. I'm an organizational consultant and a policy and communications executive, and I've spent most of the last decade working to build principles of equity into organizations and businesses around the country, both from the inside and the outside. I have a couple of different roles. I'm currently the director of public affairs at a company called Better, and we are a digital homeownership startup focused on making homeownership more accessible for Americans all across the country. Before I came to Better, I spent about 7 years leading executive communications efforts at Google and as the head of global policy for accessibility in underserved communities at Uber. And most salient to this conversation, since the beginning of this year, I've been an advisor to an organization called the Health Action Alliance. And it's in that capacity that I'm really excited to join you all here today for the 2021 National Healthcare DEI Conference. First, I'm going to tell you a little bit more about the Health Action Alliance, where we are in the pandemic, what we do, and then I want to spend a little bit of time talking specifically about how employers can play a role in advancing health equity, as well as talking to you a little bit about a new initiative that the Health Action Alliance launched just last week that will be what I think is really key in driving vaccinations, particularly as we head into what certainly feels to me, and I suspect to many other people, like a new phase in the pandemic. So the Health Action Alliance is an organization that works to accelerate the business community's response to COVID-19, to advance health equity, and rebuild strength and confidence in public health. And what we do is that we provide companies, both large and small, many of which you can see on the screen, with free resources, training, and events that help us deliver trusted, fact-based health communications to employees, employers, as well as encouraging them to communicate with customers about how to make informed decisions about COVID-19 vaccines and, over time, other public health questions. And we, as the Health Action Alliance, were founded by a group of really wonderfully generous organizations: the Ad Council, the Business Roundtable, the CDC Foundation, the de Beaumont Foundation, and the Robert Wood Johnson Foundation. And the coalition came together in partnership with a social impact firm called Madeira, and Madeira is the institution that powers the Health Action Alliance. Okay, so I want to take you back. You all remember probably where you were back about 16 and a half months ago on March 11th, 2020, which in a lot of ways feels like when people really understood the significance and the severity of this pandemic in the United States. It was on that date that the World Health Organization declared COVID-19 a pandemic. You all remember exactly what happened. The NBA canceled their season. Travel from Europe was suspended. Classes at all levels of schooling all across the country and increasingly the world were canceled. And of course, many of our workplaces began to be shut down. Now, if you fast forward to where we are now, 16 and a half months later, we're in a much better place than we were back in March 2020. But we still have lots of work to go before we can really start to say that we're post-pandemic, or that we can truly put the pandemic behind us. And we've made a lot of progress over the last 16 months. As of last week, about 60% of adults in the United States have been fully vaccinated. Almost 70% have received at least one dose, as you can see on the screen. I think that number is actually at 69% as of today. So we're inching closer and closer to the goal that President Biden set for vaccinating 70% of US adults with at least one dose. He initially set that goal for us to meet 70% with at least one dose by July 4th, by Independence Day. And so while we didn't meet that stretch goal, we will probably hit 70% of US adults with at least one shot in the coming days. And so we're making some really important progress. And it's because of the vaccines that Americans are getting that we're starting to get some semblance of normal back in our lives. And you'll recall that in May, the CDC announced guidelines stating that fully vaccinated people do not need to wear masks or maintain social distancing, either indoors or outdoors. And that, of course, unless they're in certain types of large crowds or on public transit or in places like buses, trains, commercial flights, or on airports. And before I move on to the next part of the session, I will just say this presentation won't take our full hour together. So please, as you hear me talking about anything or even something that I don't talk about, please do submit your questions. I want to make sure that we have time at the end for me to address the things that come up as you're hearing my presentation or on things related to more generally the state of where we are in the pandemic, public health, or health equity. And so because of a combination of the vaccines and the guidelines that the CDC put forth a couple of months ago, we're now at a place where almost every state has lifted restrictions on businesses. And so you can see on the map that virtually every state, with the lone exception being Hawaii as of last week, is fully open with almost no restrictions. For the most part, that's a really good thing. And so as a result, we're starting to see things like crowds are now filling the stands again at baseball games. I've actually been to 3 Major League Baseball games already this season. I'm not a big baseball fan, but the opportunity to go back to the stadium was a really exciting one that I was really happy to take advantage of. We're also starting to see concert venues lighting up again, particularly in the summer season, both indoor and outdoor concerts now taking place in many parts of the United States of America. And we're starting to see things like the magic returning to Southern California as Disneyland has started to reopen, and you're starting to see people come back to the park after more than a year of being closed down. And so that's all good news, right? We're in a really positive place relative to where we were, say, July 27th, 2020. But there's still a lot of issues that we have to work through. As states begin to roll back those restrictions that were put forth over the course of the last year, many folks, including employers, are starting to think about the somewhat complicated position of how to navigate these guidelines, how to think about whether they require folks to have vaccines, how they incentivize the people who have yet to get vaccinated to ultimately take the plunge and get their shots. And all of these questions are made even more complicated for businesses who are trying to consider how to modify their health and safety protocols for employees returning back to their physical locations or expanding their operations or ultimately trying to get back to a sort of pre-March 2020, pre-pandemic life. And different employers are saying different things, but we're starting to get data that gives us a sense of where folks are going. So nearly half of HR leaders polled in a recent survey from Gartner said that they expect their workplaces to reopen in the third quarter of this year. And we're now in the third quarter of this year. While an additional 24% said that their workplaces are planning to reopen sometime in Q4, so in the last 3 months of the year. So almost 70% of employers have already made some sort of commitment to being reopened before the end of 2021. And that's just the employers who have taken a survey, notwithstanding all of the employers who have made plans, perhaps have communicated those plans to their workforce, but weren't captured in the survey. So the takeaway here is most employers are at least considering or have concrete plans about how to return back to physical spaces with what is the case in most instances is a blended workforce of some vaccinated people and some unvaccinated people. And that's a real challenge that businesses have to navigate. And it's with that in mind, taking into account those businesses who perhaps haven't thought yet about their decision-making process, that we at the Health Action Alliance have joined the National Safety Council to release a decision tool to help employers ask and answer questions in order to help them safely reopen their workplaces. And so this is a tool that is both an interactive web platform to help you answer the questions that you may be thinking about when it comes to reopening, as well as a downloadable document that you can share more broadly. And you'll hear me talk over the course of the presentation about some of the materials that we've created at the Health Action Alliance. And this tool for reopening decisions for employers, as well as all of the resources that I'm going to talk about, are all available at healthaction.org/resources. So you don't need to think about jotting down the specific URL. Everything is available at healthaction.org/resources. And at the end, I'll remind you with that URL just to make sure that you have it. And I encourage you to check out this tool in specific because it's a really, really useful way for employers to think about, okay, how do we navigate what these next couple of months have started to look like, and I suspect what they will look like. And so among the questions that we're hoping that our decision tool will help employers answer is this question of vaccine mandates, because we're at a point in the pandemic where there is, in most parts of the United States, sufficient COVID-19 supply for every American to get vaccinated. Now, unfortunately, while we have the supply, there aren't always enough willing Americans in many parts of the country who actually want to get these shots. And we find ourselves now in a pretty precarious time in terms of that, that dissonance between the supply and the demand of vaccines. And as the pace of vaccinations has stalled, some public health officials have signaled that we may be in a place where it's going to be really challenging for us to reach what some scientists have deemed over the last many months as herd immunity. And that's important because if people feel like getting vaccinated isn't actually going to make everyone safe, then that could be a message that dampens vaccine enthusiasm, And additionally, as I'm sure you've all heard a lot about, the CDC has recently reported that the Delta variant, which, as you all know, is a more transmissible strain of COVID-19, now makes up the majority of all new infections in the United States. The good news is that also, according to the CDC, these vaccines offer a really, really high degree of protection against the Delta variant. But of course, the alternative of that, the bad news, is that a lot of federal health officials have warned that that variant still poses a significant threat to unvaccinated people, and especially unvaccinated people who are in areas of the country where vaccination rates are particularly low. And in just a bit, I'm going to talk a little bit more about where those places are, who those people are, and some of the tactics that we've learned over the course of the sessions that we've offered at the Health Action Alliance to help move those people from no's to ultimately yeses when it comes to COVID-19 vaccines. And so it was reported last week that every single state, as well as Washington, D.C., is seeing rising numbers of COVID cases, largely, again, due to this Delta variant in unvaccinated communities. The CDC reported that there are about 1,000 counties in the United States that still have vaccination rates below 30%. And COVID-19 transmission is likely going to increase in those areas as the Delta variant continues to spread. And you can see on the graph on the screen that after a pretty sustained period of declines in cases, you can see those numbers dropped off pretty precipitously near the beginning of the year, into the spring, and even into the beginning of the summer. Now, those numbers in the United States are beginning to creep back up, as are hospitalizations. And it's particularly important to look at that other metric, about deaths, and to see whether that number starts to tick up at the same pace. And so it's against this backdrop that I am coming to you all today to talk about this very complicated next phase of our pandemic response, and in particular, how we can make sure that that response is more equitable than the initial vaccine rollout. What did we learn from those initial days at the end of 2020 and the beginning of 2021? And how can we make sure that we're taking into account equity as we reach that next phase of the pandemic? And so again, the threat of the Delta variant is largely one specific to people who remain unvaccinated. And so let's spend a little bit of time taking a look at who those unvaccinated people are. So listen, there is some really good news. If you look at all demographic groups across all different types of people, confidence in vaccines has grown from when they initially received emergency use authorization from the FDA at the beginning of last year and early this year. So the poll you see on your screen is from a few months ago, from April of 2021, and it showed that 63% of adults then said that they were already vaccinated or intended to do so, and another 11% said that they probably will. And some of those numbers have actually improved in the last 3 months, but I think they give you a really good, an important sort of snapshot of where people have been and kind of where people have an opportunity to move. And so of that nearly 20% probably population, 19%, 8 plus 11, we moved about a quarter of those people to the yes column over the last couple of months. But we still have work to do to convince the remaining 70 or 75% of those people that they should get vaccinated, that it's a worthwhile thing for them to do. And so as a person who works in the business community and as a representative of the Health Action Alliance, which is really focused on leveraging the business community to improve outcomes, I think we have a really powerful opportunity to improve vaccinations rates by specifically focusing our outreach on what the last slide called the, quote, movable middle, namely employees and, importantly, their families who may be considering getting vaccinated, but maybe haven't made up their minds yet, or maybe they want to get vaccinated, but they just don't feel any real urgency in their lives. COVID at this point isn't still impacting them in a meaningful way, and so they don't feel like it's something that they need to do. Listen, the long and the short of it is that we have to be committed to continuing to boost these numbers. And for those who intend to get vaccinated, we need to make it as easy as possible for them to do so. And there are lots of tactics that we've employed, and then in particular, employers have employed in order to do that, which I'll talk about in a second. And for those who are probably yes, we need to continue to bolster their confidence and do whatever is possible to help them get across that finish line. Okay, so who are these Americans who make up this sort of so-called maybe column, this movable middle of people who maybe haven't done it, but we still think there's a real opportunity to get them to get their vaccines? Well, it turns out that a lot of the folks in the maybe column tend to be younger. Politically speaking, they tend to be more conservative than the general population. And as you can see on the screen, Republicans tend to be the least likely group to get a vaccine. And I'll pause for a second to give you just a bit of time to take a look at some of the different numbers on the screen. This is a poll from ABC News and the Washington Post from a couple of months ago. The numbers are slightly out of date, but the trends are pretty consistent over the course of the last 3 months. Republicans and more Republican-leaning people do make up the largest group of holdouts, and there's a lot of work to be done to move some of those holdouts to people who ultimately decide to get the vaccine. And it's not just Republicans, though. In a lot of ways, there are really kind of two categories of people who've yet to get vaccinated. There are the folks who say they're just not going to do it. Those people do tend to be more Republican-leaning, more likely to be rural voters. Those are the people who made up a lot of the data that you saw on the previous slide. And many of my colleagues at the Health Action Alliance have worked really, really hard over the last couple of months to understand why these people are against vaccines, and in particular, how to message vaccine education and awareness and uptick to these people, taking into account their specific concerns. But I personally have been a little bit less focused on these people and more focused on what I would say is kind of a second category of Americans who've yet to get vaccinated. And that's because many Americans who have, over the course of the last couple of months, wanted to get vaccinated have faced another challenge specific to access to vaccines. And it was particularly salient in the beginning of the vaccine rollout, but it's hard to overstate how that inequitable vaccine distribution in the early days has continued to play a significant role in how people perceive access to vaccines now. And so this map shows the lack of easy access to vaccination sites for people of color, specifically in East Baton Rouge Parish in Louisiana from earlier in the pandemic, back in February. And what you can see is that vaccine sites from February are mapped here as these very small circles on the screen. And if you look at where those circles are located and where the racial makeup is of East Baton Rouge Parish, Most of those circles are in mostly white neighborhoods, and not, unfortunately, the areas where the rates of infection and hospitalization and death were the highest. And so while vaccine access has improved, and this map looks a lot different if you look at it in July of 2021, many people, particularly people of color, have not forgotten about the inequities that defined the very start of the vaccine rollout. And so, what I always say to people is it's not enough to simply build towards equitable access, but even starting with inequitable access seems to have depressed the belief that people will be able to equitably access vaccines, whether that's true or not. And unfortunately, in many cases, it still is true. And so lots of companies and organizations, many of our partners at the Health Action Alliance, have done work to try to make clear that access is far more equitable now than it was back then. And there have been some people who have moved. Again, you saw some of that data earlier, but we're really still paying a pretty high price for how vaccine sites across this country were disproportionately focused on whiter neighborhoods at the beginning of the pandemic. Even now, 7 months after most of the vaccines in the United States were authorized for emergency use access by the FDA. Now, there have been some really powerful efforts from some folks in the business community to try to limit some of these disparities. Companies like Lyft and my former employer, Uber, as well as other partners, have really stepped up to help address access gaps, particularly when they were especially prevalent a couple of months ago by doing things like providing free rides to vaccine sites. But that can only go so far, right? There's still a lot more work to be done to make sure that every community really does have as easy access to vaccines as we can possibly make it. And it's important to note that a majority of Americans across all demographic groups want the shot. So this is not a question of, where does the desire lie? A majority of Americans in every group want to get vaccinated, yet and still, rates of vaccinations amongst Blacks and Hispanics lag quite significantly behind other groups, even though, again, these are the populations that are most negatively impacted by COVID-19. And the graph that you see on the screen is really, really stark. And I want to spend a little bit of time focused on it. And you can see on the far right of the screen, if you're Asian in this country, you're almost 30 percentage points more likely to have been vaccinated than if you're Black. 65% for Asians, 36% for Black people. That number is, to me, just completely unacceptable. And the Health Action Alliance is working really, really hard to try to get those numbers at the bottom of that graph up more towards those numbers near the top of the graph. And I was thinking about all of these different considerations and questions when I led a couple of workshops earlier this year based on some of the research that we've done with the Health Action Alliance, specifically targeted towards employee resource group and diversity, equity, and inclusion leaders. And we started these earlier on in the vaccine rollout. And the reason I was really intent on focusing on ERGs and DEI leaders was that we know that the impact of COVID and access to vaccines has been pretty unjust during this pandemic, and that the long-term impacts are going to be worse on these people from underserved communities. And so what I did is during these workshops, I asked people why they weren't getting vaccinated and provided them some tools and tips to help push them to the other side. What we heard was that a lot of people said that they were waiting to see other people get vaccinated first, which made total sense, especially other people from their community, people who look like them, remind them of themselves, people who they trust. And listen, that makes a ton of sense. We know that medical abuse in this country has been rampant. It has been widespread across many parts of the healthcare system for many, many generations. Listen, I don't need to tell you all this. I suspect that many of you live this in your roles. And so, yes, the nature of the history of medical discrimination brought up a lot of questions of distrust for many people in those workshops. And even as access improved over the past few months and more people in many different types of communities did start to get vaccinated, back a couple of months ago, some people were still having trouble doing things like getting an appointment, whether it was because of long wait times in the early days. Some people lacked technology like internet access in order to navigate a sign-up system. And a lot of pharmacies, grocery stores, and other vaccination sites took a while before they started taking walk-in appointments. Until fairly recently, a lot of people still did need to utilize the internet in order to sign up. And then, of course, a lot of people have issues needing time off from their jobs or transportation to get to and from where these vaccine sites are located. And for many people, it was some combination of lack of information or lack of trust in the information they'd received about the vaccine that can be a barrier. And I'm sure you all have seen so much of the coverage of misinformation campaigns, particularly on social media and on certain news networks, that has really limited people actually going out and getting the vaccines. And what we found, no surprise, is that sharing accurate information was really critical so that people were ready when their time actually came to get vaccinated. And I'll share a little bit more over the course of the presentation about how you all, how others out in the community can do that. But it's not simply about more equitable distribution of vaccines across certain communities, but it's also about their families. And that's something that the Health Action Alliance has really started to focus on. And so as we continue to help spread the word about the importance of vaccinations in general, expanding access and really calling on employers to help make access as easy as possible for their employees, we have actually, over the last week, launched a new initiative that we think is going to be really key over the course of the next phase of this fight against COVID. And that is a national effort around supporting working parents who want to get their eligible children vaccinated for COVID-19, as well as impressing upon those parents the importance of getting their kids other routine immunizations that may have been missed or delayed because of the pandemic. And I want to spend a little bit of time talking about why we've decided to focus in part on childhood vaccinations for the next phase of this campaign. And so I'm sure many of you all saw back in May, right around the same time that the CDC changed its guideline for mask wearing for fully vaccinated Americans. Back in May, nearly 23 million adolescents ages 12 and up became eligible for COVID-19 vaccines. So that was really great news, right? A lot of folks with kids were able to get their kids vaccinated. But unfortunately, as of last week, just about 31% of eligible adolescents are fully vaccinated. And again, this is going to be no surprise, but just like the numbers that we saw with adults, a lower percentage of Black and Hispanic children are fully vaccinated within that cohort. So we're seeing the same racial disparities within the adolescent population that is eligible for vaccines as we saw amongst the adult population that's been eligible for many months. And this is all really important, in particular because we're just a few weeks away from a new school year, and already you're starting to see some districts across the country change whether they are going to request that students come back in person. And as I mentioned, the Delta variant continues to surge across the nation. And this has downstream effects too. Many companies are struggling to hire or bring working parents back into their physical workspaces. And so there's a really strong public health and business case for vaccinating eligible children as soon as possible. If kids can't get vaccinated, there's a lot of stuff that we'll never be able to get back to where I suspect a lot of us hope that it gets. And so the Health Action Alliance has partnered with the American Academy of Pediatrics and more than 24 other national business and health organizations to encourage employers to provide working parents who may choose to vaccinate their children with the support they need to actually do it and do it as soon as they can. And so we've offered up a number of suggestions to those employers in order to facilitate vaccinations for kids. Things like providing paid time off or flexible scheduling for working parents to attend vaccine appointments with their kids, as well as other more ambitious things like hosting family vaccine clinics at work. Through all of these things, employers can really work to help remove barriers and make it easier for working parents to protect their kids and help prevent the spread of COVID-19 to other folks. And again, just like so many other things, there is an underlying racial component that exacerbates these issues for certain communities. So for example, all of these things matter for everyone, but this is especially important because Black workers are overrepresented when it comes to low-wage work in the United States. Black workers make up about 18% of all low-wage workers in the United States, despite the fact that Black people are only about 13% of the population. So when kids get access to vaccines and it puts a burden on their parents, that burden is disproportionately felt on Black families and brown families in this country. And there's new research from the Kaiser Family Foundation, which has really been kind of the gold standard for a lot of the polling around this pandemic. And what one of KFF's surveys found was that employers can actually play a really huge role in driving increases in vaccine uptake among workers. And they can do so by sharing vaccine facts and making it easier for workers to get vaccinated, as well as recover from those side effects. You'll hear me and other folks at Health Action Alliance say it over and over and over again, but doing things like offering paid time off, hosting on-site vaccination clinics, they have all been proven to be especially effective strategies throughout the vaccine rollout. And importantly, employers are not just a set of institutions that have really great access to the population, but employers are actually one of the most trusted sources of information when it comes to COVID-19 vaccines, only behind doctors, ahead of pastors, community leaders, even friends and neighbors. Employers are behind doctors, the place that people trust most. In fact, 72% of adults say that they trust their employer for reliable information about COVID-19 vaccines. And so that's why we've taken such an aggressive stance, really trying to leverage the business community, because we know what the business community says. And if more businesses can start to speak in a unified voice around the policies and the practices to make vaccines more accessible, I think it's going to make a huge difference. And so we at the Health Action Alliance have created a coalition of more than 24 organizations that have committed to urging employers to consider following actions that are going to support working parents. And that's everything from providing paid time off, again, for flexible scheduling, for folks who are trying to get vaccine appointments with their kids, to caring for children recovering from vaccine side effects, and again, really importantly, helping parents catch up on their routine immunizations that may have been delayed during the pandemic. It's important for employers to offer transportation, not just transportation, things like language support for people for whom English perhaps is not their first language. Or as I mentioned, internet has historically been a barrier for folks getting vaccine appointments, offering on-site internet access or a means for people to utilize internet elsewhere to schedule vaccine appointments is really, really key. Employers can do a lot of work connecting families to free and discounted childcare if they need support managing care for multiple children, particularly if some of those children are eligible to be vaccinated, when some of those children are not eligible to be vaccinated. A lot of families are navigating that now. If they have a 13-year-old and a 10-year-old, well, right now their 13-year-old is eligible to get vaccinated, but their 10-year-old isn't. And having to juggle different children in different states of eligibility can be really, really challenging. It's really important for employers to offer incentives to help get eligible children vaccinated. And the last thing is employers can do a lot of work to partner with local health departments to host, again, on-site vaccination clinics for employees and families, including eligible children. You would be surprised at how open local health departments are to sending a mobile vaccination clinic to an employer. They're, as much as anyone, intent on making sure that these numbers get up. Those public health departments are also encouraging employers to sustain these policies so that they're not just instituting them now, but they're instituting them as time goes on, and in particular when younger children become eligible for COVID-19 vaccines. And we're not sure exactly when that's going to happen, but the latest guidance that we've received from the Biden administration and other external sources is that younger children below the age of 12, are likely to be eligible for COVID-19 vaccines either by late 2021 or early 2022. So we're waiting with bated breath, just like everyone else, to see what that process looks like, especially as we head into the fall. It starts to get colder and more kids, many of whom aren't vaccinated, are heading back to schools. And so, as I mentioned, we've partnered with the American Academy of Pediatrics to create a comprehensive employer toolkit that includes recommended actions, key messages and communications tools, fact sheets and FAQs for employees, a comprehensive vaccine video series to help share facts about vaccines, and links to tools and resources from the CDC, from the American Academy of Pediatrics, as well as a ton of our other partners. Like all of our resources, you can find them at healthaction.org/resources. And I just want to remind folks that we're going to be going into Q&A in about 10 minutes. I'm just nearing the end of the presentation. So if you have questions, please submit them. I would love to hear what you're thinking. And so when it comes to our childhood vaccination initiative, we launched this campaign just last week, last Monday, so we're 8 days in. But fortunately, we're already excited to have seen several corporate leaders announce their commitments for working parents. And it's this type of sort of quick and decisive action that is a really powerful step in getting other employers to think about what it means to provide time and space for parents to get their kids vaccinated. And we're really hopeful that we're going to see other employers follow suit. And we're in conversations right now to get some of those other businesses really excited about doing good on behalf of their workers too. And I want to highlight just a couple of examples of this because I think it's salient to see how other companies are phrasing it, so that we can be thoughtful in how we encourage new companies to get on board with this initiative. And so I'm biased because I used to work at Uber, but I do want to highlight that Uber was one of the first companies to sign on to this initiative. And they announced that they're providing additional paid time off for every Uber employee all across the world to take their children to their vaccine appointments, whether it's now for kids who are eligible or in the future for kids who are not yet eligible for COVID-19 vaccines. And that extends to helping cover the time for when parents have to look after their kids if those kids have significant vaccine side effects. And again, it's not just about COVID vaccines, but if because of the pandemic, you haven't been on top of getting your kids to their pediatric visits for other immunizations, then this policy covers parents taking the time for all of those different components of what they might need. And I'm really excited about the step that Uber's taken. But I will say candidly that I think this is just a first step. And I've expressed this to some of my colleagues who are still over at Uber. One thing that I would really love to see Uber consider is making the same type of commitment that they've made around their employees, around paid time off, to some of their driver population. Because when you think about who makes up the driver population, who makes up the employee population, the working parents who have to juggle multiple responsibilities, for whom they may have more limited access to childcare, and thinking about where the impact of the pandemic has been felt worse, disproportionately on Black and Brown Americans, they make up a disproportionate number of people who are Uber drivers. And so my hope is that Uber will extend and expand this commitment to their driver population. And we're in conversations with them right now about what we can do to make sure that it's not just employees who are covered by this policy. Additionally, a company called Hill Holiday, in the context of our announcement of our childhood vaccination campaign, they announced last week that they're offering unlimited paid time off for vaccine appointments, as well as visits to other pediatric appointments for all of their employees and their families. And the company, very excitingly, is going to be hosting an on-site vaccine clinic when their offices reopen just in a couple of weeks later this year. So we're really excited to see that. And that's the kind of thing that we would love to see other companies also take into account as they're thinking about how to deliver the best outcomes to their employees. And so I just want to end with a couple of things. I want to leave you with a few takeaway thoughts about what we've learned that works with talking to people who may need some convincing about getting COVID-19 vaccine, and how we can get them from maybe on the fence to realizing that this is in fact the right thing to do for either them or their families. And again, if you have questions, please let me know. I look forward to answering anything that might be on your mind once we get to the end of the presentation. So first, I think it's really important to, when you're having conversations with people who might be hesitant, to listen and lead with empathy, as I'm sure all of you do. What I learned from the workshops that we offered earlier this year is that it's really valuable to offer space for people to share their story of loss or becoming seriously ill from the virus. This will not only help employees heal emotionally, but it can also encourage others to get the vaccine. People are more likely to be of the mindset that they can get sick or infect others after they hear this has happened to someone they know, or someone who knows someone personally. And it's okay to acknowledge that it's okay for people to have questions. And I found myself in some of these workshops actually listening more than I was talking, because oftentimes people just want a forum to talk about their concerns, and they can almost get themselves to feeling more comfortable with vaccines just by talking out the concerns or the questions that they may have. It's important to provide trusted, fact-based health information. You can certainly share any materials that you might find useful on the Health Action Alliance website at healthaction.org. Another piece of advice is really to stay away from politics. Unfortunately, because of the nature of the 2020 election and the effort around the vaccine, then a lot of people's perceptions of the vaccines have become really, really political. And so very simply, I would just say, if the discussion steers to politics, do your very best to bring it back to science. It's not worth engaging on politics. You're probably not going to convince someone to change their politics around the vaccine. And importantly, address specifics. Let people know that, hey, if you're on the fence, make it really easy for them. Tell them where to go if they actually want a vaccine. If you're not sure, vaccines.gov is a really great place to start. Remember that stories really, really matter. I tried to model this behavior as I was conducting workshops on behalf of the Health Action Alliance earlier this year. I, in fact, I was a participant in the Madeira vaccine trial. And one of the reasons I decided to be involved in the trial before we knew the efficacy of these vaccines was that I understood that it was going to be really important for people from communities that are oftentimes treated poorly by the public health system, by healthcare in the United States, to see people who looked like them, who went through the process and have been protected by the vaccines. And so I always go out of my way to share my story. And no matter what your story is, if ultimately you decided to get vaccinated, it's really valuable to share that story, because it can oftentimes help people understand that there's nothing to worry about when it comes to these vaccines. And finally, even if you don't know someone personally who's not sure about the vaccines, the reality is unvaccinated people are in every community. And so it's important to check out, if you're able, to check out local nonprofits or your local public health department to see if there's a way that you can contribute to promoting vaccines or helping with vaccine administration. There's always something you can do. And the more we work to get as many of the unvaccinated people vaccinated, the less likely it is that we're going to get to a point where more contagious, more vaccine resistant variants start to spread in the United States. And so I just want to say thank you. I suspect many of you are doing really great work to promote vaccines, to promote public health, and importantly, to promote public health and healthcare equity. And so just on behalf of the Health Action Alliance and all of our partners, thank you for all the work that you've done, and thank you for joining the session today. I'm sure that you may have questions after the session is over, and so you can send any of those questions to questions@healthaction.org. Again, you can see any of the resources that I talked about today at healthaction.org/resources. And if you have questions for me personally, you can always reach out to me. My website is just www.malcomglenn.com. And so again, I just want to say thank you. And I look forward to any questions that you all may have submitted over the course of the presentation. So thanks. I will stop sharing my screen. Okay. Let's see if we have any questions. Great. We have a couple of questions that came in. So I will read out the question and I will tell you what I think about the answer. So the first question is, what has been the feedback from your staff on vaccination hesitancy initiative? Well, listen, I've been really, really pleased with the degree to which people have responded positively to the workshops that we conducted earlier this year. We gathered a lot of feedback from the businesses that participated in the sessions to understand how they used the resources, whether they were actually able to use those resources to convince people who were on the fence, and ultimately what impact it made. I'll just give you one example. We had some really great participation from Utz, which is the snack company that I'm sure you're all familiar with, pretzels, cheese balls, chips, all sorts of things. And they were in the process of continuing to manufacture snacks during the pandemic. And so they conducted on-site vaccination clinics at some of their manufacturing sites. They printed out Health Action Alliance materials and handed them out in person to folks on the manufacturing line. And importantly, a large proportion of their population is Spanish speaking. And so they printed out some of our materials that we offer in Spanish and delivered those to folks on the manufacturing line as well. And I was really, really pleased. We followed up with the folks from Utz. And it turns out that after delivering those materials and having conversations with vaccine hesitant employees, they saw a massive uptick in vaccine adoption. And so, that's just one example. And we have a handful of other examples from some of the other companies that we worked with. But what we've seen is these tactics work. And when you enable access, when you stick to the facts, and when you really, really make it easy for folks to get themselves and their kids vaccinated, it makes a huge, huge difference. So I've been really, really pleased with the degree to which we've seen positive responses to the efforts that we put forth. Okay. Next question is, does your organization have any programs or partnerships that connect those with little access to healthcare to appropriate free or low-cost resources? Great question. We have a number of resources that help people get connected to healthcare or vaccine access when they may be someone who doesn't have health insurance in the first place. The first thing that we offer in our resources is it's really important to remind people you don't need health insurance in order to get vaccinated, and no one at any vaccination site anywhere in the country is going to ask about things like your immigration status when you go in to get vaccinated. And so what we found is if we can disabuse people of the fears that vaccines are going to in some way invite further scrutiny on their insurance or their immigration status, or that it's going to be a cost burden to them, we just make sure to tell people that's not the case. Every vaccine is free. If there's one message that you lead with folks who might be worried about that, just continue to hit home on that. Every vaccine in this country is free, whether or not you have health insurance. The vaccines are all free, and your immigration status or any other status doesn't matter at all. We found that when you stick with those facts, it goes a long way in getting people on board when they may have had some concerns before. Okay. Looks like the next question is, let's see. What is the biggest challenge you have faced in expanding vaccine access for employees or even in the community? Really, really good question. I think there are two. I think there are two really, really big challenges, and I touched a little bit on them before. The first is access. Whether it's the case now or not, a lot of people, based on the inequitable rollout of vaccines earlier in the year, didn't believe and continued to believe that access is going to be challenging for them. And so they haven't even investigated in months whether there's an appointment at their local pharmacy or at their local grocery store. And this happens a lot in not just the healthcare space, but across other spaces related to equity, is that when a process starts with inequitable outcomes, it becomes really hard to convince people who are of those marginalized communities that equity is now a point of focus. And so access, particularly in those early days, even though access has improved, has been a really, really big challenge in terms of getting those people who might be open to the vaccines, but simply don't see a sense of urgency when it comes to vaccines. That's one big challenge. The second big challenge has been among people who have political aversions to getting vaccinated. And I would just say a sort of subset of that is people who are, quite frankly, victims of misinformation. There have been really, really widespread and rampant misinformation, intentional misinformation campaigns to deter people from getting vaccines. And that's been really hard to overcome. People are choosing to take their information from less fact-based sources, from social media, from certain news networks, and presenting them with facts can make some progress in getting them on board with vaccines, but it doesn't always do as much as we would like. And so when it comes to who we are most optimistic about getting vaccinated, who's yet to be vaccinated, we want to get everyone vaccinated. We don't want to discriminate against anyone. The more people are vaccinated, whoever they are, the better it is for everyone. But what we've realized is that it seems like there's more open to people who have fears around access or inequitable access than there is openness around people who might have more politically motivated aversions to the vaccines, or for whom misinformation and non-fact-based information has really informed their thought process. And so we continue to work to try to influence both of those communities, but the access community, the folks who are largely in that graph that I showed earlier, that movable middle, are the folks that we're really, really focused on going forward. What is the biggest vaccine access success story that you can share, if there is one? I'm biased again, because I used to work at Uber, but I'm really, really proud of what Uber and Lyft did earlier this year. Both companies had slightly different options within the app, but effectively what you could do is you could get a ride both to and from your vaccine appointment. And if you were getting one of the 2-dose vaccines, to and from both of your vaccine appointments for completely free. And this partnership was forged in concert with the Biden administration. We're fortunate enough to have both Uber and Lyft as Health Action Alliance partners. Both have also signed on to be stewards for our childhood vaccination initiative. And when we did initial research, and when we looked at some of the initial polls in the early days of the vaccine rollout, transportation was a major barrier. And the time that it took, if you didn't have access to quick and reliable transportation, was a real challenge, a real barrier to access. And so the way that both Uber and Lyft, who are competitors, right? They're competing for the same market, kind of put aside their differences and said, we're going to work with the Biden administration in order to do what's not necessarily best for us as a company in the short term, but what's best for all of us in the long term. They put aside their differences and really made it easy for people to get to and from vaccines if they didn't have access to transportation. I was just really proud to see, 2 companies, again, I'm biased because I used to work at one of them, but 2 companies in particular who are competitors, to really not worry about who was going to look better or who was going to look worse, but ultimately to say, this is a situation where there's a clear right thing to do. And it's important, in fact, it's imperative for us to contribute as much as we possibly can to that right thing in order to make sure that as many people as possible are getting access to vaccines. So I was really, really proud of that. Okay, and it looks like have a couple more questions. What is the difference between health disparities and health inequities? Really great question. I'll tell you what I think. I think of disparities as the outcomes, right? The reality is that Black people are more likely to contract, be hospitalized from, and die of COVID than their white or Asian counterparts. That's a disparity. I think of inequities as the inputs, the reasons why those outcomes and disparities exist. And so the reasons why, I'm sure we've all talked a lot about over the course of the last many months, it's lack of access to healthcare, historic barriers and points of discrimination in the healthcare space. It's the greater likelihood that Black and brown Americans are going to be frontline workers or are going to be folks who hold lower wage jobs that require them to be in person. And quite frankly, in many instances, required them to be in person for their job during the course of the pandemic. And so I think both are really, really important, right? We should be really committed to mitigating health disparities to as much of a degree as we possibly can. But we can only do that if we really understand why. If we understand the inputs that create those less equitable outcomes, then we can make sure that we push forward on making those outcomes more equitable going forward. And that's why we're so excited about the childhood vaccination initiative. Is we did our very best, and I'm really, really proud of the work that so many organizations and institutions and advocates put forth when the vaccines initially rolled out. But the reality is the pandemic's not over, and it's going to continue to be really important for us to get folks vaccinated, and it's going to be especially important to make sure that kids are vaccinated. And so if we can learn what we can from the inequities that helped create the disparities earlier in the vaccine rollout, I'm confident that we can do a much better job of making sure that those disparities are not as apparent as we continue to get more and more people and eventually children vaccinated in the weeks and months ahead. So I think there's a lot of work to do, but I'm optimistic that if we all band together and really focus on the facts, we can get more and more people with shots in arms. And so I think that is the last question that we had time for. Again, I just want to say thank you. I encourage folks to head to healthaction.org to learn more about all of our resources, all of the efforts that not just we're doing, but that so many of our partner organizations are doing as well. And I just want to say thank you as well to all of the work that I'm sure that you all have been doing over the course of the last 18 months and even beyond. And I suspect will continue as we continue to forge ahead in this pandemic. So thank you so much. And I really, really appreciate you all joining the session.